I got cystic fibrosis. See, I've got cystic fibrosis.
Hello again, everyone. Erin here at The Salty Warrior on Instagram. I'll put a little thingy right here somewhere. So for this video, I am going to be talking about how I have been told my entire life I am not the typical patient. So when I was diagnosed, if you watch my other video, I said I was healthy. I was gaining weight, I was growing, I had no other issues. The doctor did the sweat test, numerous times because she did not believe that, one, I had CF, and two, that I had the most common genetic mutation, which is usually thought of as the most aggressive, double delta F508. So I lived a very good childhood. I was really not sick at all. I was in the hospital once in 3rd grade, and I was healthy all the way up until high school. I have no problems gaining weight as well. I am not the typical very skinny CFer, and I actually did a post about this on Instagram a little while ago, and so many of my CF friends and followers on Instagram reached out to me and said, thank you for making this post. I am not either. I was so happy to see that other CF patients weren't, the stereotypical, really skinny, underweight, malnourished, that I was not alone in this, because when I started going to my new clinic, the first thing they said to me was, are you sure you're double delta? You look really good for a double delta CFer. And, which is a wonderful compliment. I'm not saying it isn't, but it's difficult to hear that sometimes, especially when you're feeling ill, to hear, oh, but you look so good. So I am not the typical patient. I have never had problems with weight. My lung function, for the most part, has been fairly good and stable. I think right now I'm at 72 or 74%. And I am very, very fortunate for that at 23 years old. A lot of people have asked me what I have done to maintain that. And I'm gonna be honest with you guys, I don't know. I never liked exercise. I still don't. I don't exercise regularly, which I know is not good. I'm trying to change that, but I'm not in an exercise program. I don't do anything other than being very compliant with my, my treatments, my breathing treatments, my vest, my medications. I just feel very fortunate, and I wish every CF patient could be so fortunate. So if you watch my other video, I mentioned that I have an infection called Mycobacterium abscessus. That is, my variation of it is called MAC, M-A-C. If you have been following CF world news recently, you may have heard of an experimental treatment called GM-CSF. You inhale it. It's been shown to help so far get rid of the Mycobacterium infection. I have been inhaling it for almost a year. I think exactly it'll be a year in July. And my lung function did go up slightly, but my infection levels were not going down. I am also not the typical CF patient because I don't cough anything up, any mucus or sputum, as some may call it. I have a very, very difficult time coughing anything up. So it's hard for them to really get good, good samples from me. So we usually end up doing throat swabs, throat cultures, where they take a Q-tip and they shove it down the back of your throat and twirl it around, if you don't know. So I have been getting those done, and I am so packed full of this Mycobacterium abscessus. A simple throat swab has been growing it, which is pretty rare. I believe my clinic said they've never seen it before. So after quite a few months on this, my last appointment was in April. So we were thinking, okay, why isn't this going down? Some of the other patients had been on IV treatment for Mycobacterium abscessus before they started GM-CSF. And we were thinking, well, maybe I need to do IV treatment again and then restart the GM-CSF. I and my doctor talked, and we said, why don't we test my sinuses for it? Because if you don't know, any infection you have in your sinuses, they're connected to your passageways, your lungs. So anything up here is going to drain down to your lungs. They thought, well, they've never seen, and I don't believe it's ever been recorded that someone has Mycobacterium abscessus in the sinuses. So they were saying like, oh, we'll do it, but that's probably not it. My mycobacterium, it's supposed to take 6 weeks to grow out. Mine goes out in about a week. So really full of it, really fast growing. They called me a week after clinic and said, yes, you have it in your sinuses, so we need to game plan. So I have some awesome sinus nebulizers. To get a special, it's a Pari nebulizer, sinus nebulizer, and it vibrates. So I am on the GM-CSF on 1 week, off the other, morning and night, so twice a day. And so now I'm doing 1 dose inhaled into my lungs and 1 dose up the nose. And we're hoping that might help finally get rid of the Mycobacterium abscessus. So we have just started that. I see my ENT every CF appointment as well, because they're luckily in the same building. So we'll probably do cultures again to just see if it's gone down at all, what's going on there. So a lot of people have questions about the GM-CSF. I was taking sterile water, but apparently there's a shortage of it now, so I do sodium chloride. I draw 4 mLs up in a syringe, and then the leucine comes in a little glass bottle, and I just slowly shoot it in there. You don't want to make it bubbly. And then I leave it for 5-10 minutes to fully dissolve, draw it back up, and I nebulize it, either in my lungs or the sinus nebulizer. Sometimes I notice I get a little chest tightness on it, so I just take an extra dose of inhaler, but I really haven't noticed many bad side effects of it. The one side effect I'm tracking right now, I think it actually has the potential, for me at least, to ramp up anxiety on the week I'm on it, because I notice I don't sleep as well the week I'm on it. I'm anxious about just like silly things. But overall, I think if that's the worst thing and it helps get rid of this bug and I can feel so much better, that's not bad to me. Other than that, it's been pretty easy to do it. I was fortunate my insurance covered it, and it's so far proven to be at least a good treatment as far as getting my lungs up. Now, because I mentioned I'm double delta F508, a lot of people immediately ask, well, are you on Orkambi or the new drug that just came out? I believe it's called Symdeko. I'm not sure if I'm pronouncing that correctly. Anyways, I am not. I tried Orkambi. My body, when I am going to have a drug reaction, reacts within about 10 to 15 minutes, sometimes less. Within 10 minutes of taking it, I knew I was in trouble. I ended up with a horrible migraine, horrible stomach pain, and then I just wasn't feeling well. I slept the entire day, and I woke up with a couple hives on my stomach. And I thought, okay, that's not that bad. A few hives. It could be from anything. I took my second dose and went to bed. I could not sleep that night. I was tossing and turning. I was just itchy everywhere. I woke up. I had hives from the top of my head all the way down my back, to my toes, head to toe hives. I was having a really hard time breathing, so I called the doctor on call for my clinic because, of course, it was a Saturday. And he said he was pretty sure it sounded like an anaphylactic reaction, and he wanted me to go to the ER and stop the medication. I did not go to the ER because it would have been 12 hours since I'd taken it, but I did have to stop Orkambi because of that. So Orkambi had 2 ingredients, and Symdeko has one of those 2. Because we don't know which one I was allergic to, my clinic kind of just seemed to be a little uncomfortable about starting me on it. They were going to contact the manufacturers of the medication, Vertex, and see what their thoughts on it were. I haven't heard back if they ever reached out, if Vertex ever replied. My guess is they're probably going to say they don't want me on it because, if you have really bad side effects on it, they have to publish that, and, they have to warn other patients, and it can, potentially mess up the drug and stuff, which I get. So my clinic had said if I did ever start Symdeko, I would have to get it through a pharmacy, and then I would have to come into the hospital. They would admit me, start an IV and all that jazz, get like an EpiPen or Benadryl or whatever ready, and they would have to watch me. If I took it the first day and had a reaction, obviously I would be done. If I didn't, they would want to watch me for a couple days to make sure my body could handle it. At this point, since I haven't heard back from my clinic and I am going to be starting school in about a month and a half, we've just decided to wait. We've heard there's more drugs coming down the pipeline that will not have either of the two ingredients in it, so I might try those. In a perfect world, I would love to be on Orkambi or Symdeko, because I've heard that it can help maintain your lung function, if not increase it, and a lot of other benefits. But unfortunately for my body, for whatever reason, it can't happen, which stinks, but it is what it is. So that's kind of my life in a nutshell. I'm different than the typical CF patient. My clinic wants all their double deltas on Orkambi or Symdeko, and I'm allergic, and they've never seen this type of allergic reaction in somebody before. So, they've never seen MAC in someone's sinuses before. So I'm kind of weird. I'm just kind of a puzzle and a mystery. And I get told all the time I'm not the typical patient, and that's fine. I am going to try to do my best and, stay up with treatment compliance. And hopefully I can just maintain and prolong my life for many years to come, and hopefully in the sense of being healthier, hopefully I can stay being the atypical double delta F508 CF patient, because if I can keep my weight up, if I can keep my lungs up, I can potentially live until there's a better treatment that I'm not allergic to, or like we all hope someday in our lifetimes, there will be a cure. So that's me. Thanks for hanging out with me on my videos on Staying Salty's channel. It has been a pleasure to be here. Thank you, Staying Salty, for having me be on your channel. Bye, guys.